Okay, hi everybody, it's Matt, Dyan, welcome back to OK Aussie. It's 1:17 p.m, Wednesday, 3rd of September. It's 20 degrees outside. I've just put pulse oximetry onto Dyan. She was literally just eating cheese, literally. Just gave her a slice of cheese. She's passed it back to me because she's gone into a seizure. So stick with me, let's see what happens. It's okay. I was just reading my book. That's going to get put away straight away. It's alright. It'll be okay. Max is here. He's unaware, but Max is actually going to go out of the way in case there's any vigorous activity with the seizure. Sorry, Maxie. We had predictions. We actually did a video just a little bit beforehand thinking that this might be going on. Dawn's been running high temperatures, just on the cusp of 38 degrees. She has been ticking just beforehand. So ticking neurologically is an indicator. It's all right, but lip smacking, so there's a bit of segmented cranial dystonia stuff happening at the moment. Let's get Bluetooth up. Let's get the alarms on and active so we can hear. Let's bring up that device. Like I said, Diane's temperature a few hours ago was just on the cusp of 38. She's 37.7 degrees still, and that's after having Panadol Osteo. You can see the oromandibular activity that's going on in the face. I am so glad that she didn't try and eat and swallow that cheese, and she was able to give me back just immediately before, seconds before going into this. It is so good. Sorry, Bubba. Arms across in a figure 4 position, quite common with clonic seizures. Whole body is shaking. She's actually had some shaking activities earlier today in the hand, so her hand hasn't been steady. We know that she's running fevers with the higher temperatures, but we also know that she's got infections that she's running. Oxygen level is at 94%. Heart rate is high for Diana, 86%. 86 BPM, not percentile. Axial tilt with a right rotation. Focal dystonia, most likely in the left hand. It's okay, sweet pea. Hey Google, set timer, 9 minutes. We're already 1 minute in. Thanks. That time will help give me a countdown to see how this progresses or if it changes and whether I need to engage with medication. Massive facial activities going on right now, which you can't see. It's all right, bud. You're doing the best you can. Oxygen starts at 94, heart rate's just accelerated to 103, 108. So Dyan is going through a seizure at the moment, 122. So currently, as you can see, oxygen stats are at 95, heart rate's at 110. It's all right. Midazolam ready to go. Clonazepam ready to go. It's alright, Kim. You're doing really well. This is not comfortable at all. Okay, fixed in turn of both feet right at the ankles. You can see also coming from the knees. That's why the knees are mobbling together. So the rotation's coming from the hips. You can still see the position It's all right, darling. I'm right here. Oxygen stats are at 95%. Heart rate has come down to 92. Normally her heart rate in a supine position should be 52 to 55. So she's running a high heart rate, which is what we expect when she's running seizures like this. The oromandibular is where the jaw is highly activated at the moment. Oh my gorgeous girl. It's alright, I'm right here, kitten. So we know that she's been running temperatures. She's been running temperatures around the 38 degrees for almost 2 months. We know that she's got infections. She started a secondary antibiotic today. Blepharism, so the left eye is fully closed. The right eye is almost half open. So blepharism is what affects the eye, eyebrow, eyelid muscles. The oromandibular has been all the jaw activity. You can see her red face, the malar facial rash. Hello, darling, you're coming around now. 123. It's all right, Papa. Oxygen stats are 96%, heart rate's 92. We want to see that heart rate come down. She's still shaking quite massively. It's all right, Papa. It's okay. You're doing really well, darling. I'm right here with you. Now, quite commonly Dyan rolls with her seizures, and a left roll. She's not doing that at the moment, which is great. But we just got to keep an eye on aspiration, that she doesn't choke. Both legs are remaining intern. A lot of tensile, which is the contractions coming from the dystonia in the right foot, particularly. Left is probably about half. So dystonic, focal dystonia in left, notic in the right hand. Slight axial tilt of the neck inclined to the left. Oxygen stats from 97%. Heart rate is at 88. So we know her temperature's up. We already know that she's been having some Panadol osteo to bring that down. It's 125. We have 4 minutes 32 left on the timer. It's all right. Going into a full tonic seizure. It's all right. It's okay. It's okay. This is the atypical left roll. Just protecting the arm. It's okay. It's okay. It's okay. It's okay. You can't control this, sweetie. You can't control this, Papa. It's okay. It's 126. Okay, the axial tilt is actually causing flexation of the neck, which is making it difficult. So when you've got a crossover between dystonia and seizures, we're having difficulty being able to move certain body postural positions. It's okay. Heart rate is at 102, so it's accelerated above her baseline, which should be around 55, as I said. Oxygen saturations are at 96. I'm just reading the pulse oximeter on her wrist. We have got alarm set on the device behind me, which will alert, audible alerts if it hits certain thresholds. It's okay, relax and breathe. Come on, from here. Come on, it's okay. Good girl. Good girl. Good girl. Relax and breathe. It's all right. It's okay. It's okay. It's okay. Good girl. Just removing the hot pack. Hasn't actually been on for her. It's alright, you're doing well. Oxygen stats are at 96. Heart rate is coming down to 87, 85. How gorgeous. Alright. That's your Tourette's tick, isn't it, Bubba? okay. I get it. Your hips are not allowing you to move. That's okay. I have 2 minutes left on the countdown timer before I apply medications. I can't give an oral medication in this state. Dyan cannot swallow. So an oral delivery, which we'll do in clonazepam, is not possible at this point in time. I'm going to have to give her some midazolam in a moment if it doesn't subside. So, obviously with hypermobility, Dyan's got EDS, or down loss on top of the condition. That will lead to potential subluxations and dislocations, which we'll check after the fact. Blood pressure for Dyan, very high. Now normal people will go, yay, 120 over 80. Here's 124 over 84, heart rate 69. Dyan's baseline should be 80 over 60. So we've got about a 45-point increase in systolic blood pressure for Dyan at this point in time. That's normally indications of obviously going through seizure and pain.
Is it good?
It may be, sweetie. I'm hoping it is. Oxygen stats are 97%, so we haven't had any oxygen crisis, which has been great. Heart rate's coming down to 73. That's beautiful. I like that. How are you feeling? Still ticking through the upper torso, still getting obviously blepharism and oromandibular. She's got no control around the face. There's about 38 seconds left on the timer. We're going to have to give the emergency medication, the midazolam oral and buccal. It's alright, gorgeous. You're doing so well. It's 1:29 p.m. Hey Google, stop. Midazolam, 5 milligrams per mil. You're doing okay. Max is over here. Will is in the tunnel. We've got secondary seizures coming through. It's 1:30. Hey Google, set timer, 10 minutes. The response time for the midazolam should be under 10 minutes, so we should see this all subside within about 7 to 8 minutes, hopefully, for Dyan. This is the feet, so there's a lot of distortion, a lot of tension through these positions. This is the upper torso. This is what the face is doing. It's okay, Bubba. Countdown is on. Medication will kick in. It's 97% oxygen saturation. Heart rate is still high for Dyan at 97. Syncope. 1:31. Conclusion of that seizure set. It's okay. Upper body, torso twitching. Going through for the full leg. Sorry about that. I would have to apply medical oxygen as a supplementary oxygen at this stage because her oxygen levels have been fine. She's currently at 97% oxygen. Heart rate remains high, 82. I need to be careful of her chest if she goes into tachycardia and if she has arrhythmia, which occasionally occurs. I just want to see if she has any angina. Where at the moment I'm going through a lot of segmented cranial dystonia in the face. Alright, Bubba, I'm right here with you, okay? Right here with you. Countdown timer that remains. 8 minutes left. Medication should be kicking in, starting to take effect. Medication that we've used is midazolam, an emergency medication, ASM, anti-seizure medication, in this case for Dyan. Dyan has a very low seizure profile that comes with susceptibility because of her genetic condition, 22q11.2 deletion syndrome, full tonic clonic seizure. It's alright, Bubba. 65% of patients with 22q 11.2 deletion syndrome will have seizures, seizure-like conditions. A lot of tension through sternocleidomastoid, trapezius. A lot of tension locked in through coming from the hips. Intern of the right foot, left foot is in focal dystonia. So we've got a mixed neurological bag of dystonia as well as seizures happening. It's alright, gorgeous. We'll come around soon. 7 minutes left on the timer. Oxygen stat to 97, heart rate 72. So 22q 11.2 deletion syndrome, what is it? It's a genetic disorder. It's a microdeletion on the long arm of the 22nd chromosome, missing between 30 to 50 genes, 3 million DNA building blocks, and affecting anywhere up to 185 clinical symptoms. Dyan does have autism, ADHD, OCD, Tourette's, multiple different seizure types neurologically, things such as scoliosis, fatiguing conditions like ME/CFS, hypermobility conditions like Ehlers-Danlos, gastroenterology, things like gastroparesis. Whole range of conditions come part of this mixture. Neurologically, we can see Tourette's, ticking, which has been happening just prior to this commencement. We saw her having aphasia. Now, normally aphasia affects the ability to speak with word finding, slurring or stuttering, and we commonly see that post-ictal aphasia. She was having this pre-ictal, so as an early indicator that something's going to happen today, and we talked about that. So we're talking about different word changes. So she was talking about gelic-tites and gelic-mites rather than static-tites and static-mites. She was replacing certain letters or words and making up nonsense with that. So her brain's been offline, and we're showing indications about 4 or 5 times today. We were seeing that she was also heightened in her stress levels today. Agitation and anxiety was increased as well. Further tonic-clonic seizures are occurring at the moment. It's 1:35. 5 minutes 30 left on the countdown. The medication should start to be really kicking in. Now, that medication will help with the tonic-clonic seizure side of things. It may not help so much with the dystonia or the Tourette's. They might still be seen afterwards, and I will give her some clonazepam as a muscle relaxant once I can bring that down. She's still running fevers. She's still hot. Febrile is the pre-cause. So with patients with 22q, there's a high likelihood of seizures being caused coming out of febrile situations, so running high fevers, having infections, having electrolyte imbalances, which also is part of it as well. Changes in things such as calcium, potassium or magnesium. And that's your tick for Tourette's, isn't it? Vocalized. Oxygen stats, 97%. Heart rate is at 72. It's reduced massively from the 120 that it got up to. So I'm really happy for that. How are you feeling? You with me? Okay, not able to vocalize, but an indication that she knows that I'm here, which is really good. Cognitively, because she can quite out of it. I'm still seeing blepharospasm, so affecting things like eyebrows, eyelids, and eyes opening. I'm still seeing some tweaking and shivering. I'm still seeing some oromandibular activity of the jawline. Hello, Gorgie. It's alright, you should be coming around. The medications are kicking in. 4 minutes on the countdown timer, and things should be a lot better for you very shortly, okay? Believe me, trust me, we're here. It's 1:36 p.m. It's okay. You're meant to be eating lunch, I know. Well, you know what? This was the cheese that you were starting to eat because you couldn't sit up. So she indicated first that she was hungry. She wanted to have lunch. We were planning her nice salad. We couldn't give that to her because she couldn't have the energy to sit up. So she asked for cheese slice instead. She's still twitching at the moment. Luckily, just as she was about to take her first bite into the cheese slices, she'd actually cut them into four quarters. She passed me the cheese and literally was like a focal aware seizure at that time, stepping into the tonic-clonic. She went offline immediately at that point in time. Your cheese is over here. I've got your cheese safe. Okay?
Don't look at me like that, Max.
Max, you're being very judgmental. Seriously, I think he's looking at your cheese personally. It's okay. It's okay. Hey, Disney princesses don't cry.
I went on some medication. It's my fault.
It's okay. Dyan is reducing, trying to baseline herself out on certain types of medication, which means her threshold level for seizures has increased substantially and exponentially because of that.
It was affecting my GI.
Yes, it is, because there's a knock-on effect. For every action, there's an equal and opposite reaction. You take one medication to improve symptomology on one aspect, it can cause other side effects affecting 3 or 4 other areas. And Dyan was trying, really working out the GI tract stuff, because if you're taking a lot of muscle relaxants, you don't have the stimulation effect to actually work the bowels. And with gastroparesis, which is the dysmotility of the GI tract, she's trying to avoid things like the muscle relaxants, like the clonazepams, the Valiums, and those sort of things, because it does make it worse. However, your threshold increases subsequently, and of course at the same time, you're at higher risk when you are running fevers. Okay, unexplained fevers, unexplored, doctors couldn't get to the bottom of it. Then we realised with the urinary test that we did recently that she's running a UTI, and with that susceptibility, having infections, that can lead more to susceptibility of having seizures for this cohort. Her sleep has also been not as good a quality as I would like it. Difficulties with initiating sleep, and also the quality getting to that deep sleep and sustaining it. And of course, we know that when sleep doesn't work quite well, that was the first of the yawns. Count those, because what we look for is a good 2, 3 yawns. Ticking, motor tics are so common. A bit like earthquakes. You can have the pre-tremors and the post-tremors of an earthquake. Same concept for the seizures for Dyan specifically. There were Tourette's motor tics beforehand this morning, and I was pointing them out saying, look, you've got the indicators, unfortunately, of a potential S seizure happening today. I did not make it happen. You are able to be read like a book. High fevers, infections, poor quality sleep, high levels of pain, fatigue. What's that all equal?
But I didn't pick it up. You know why?
My bubba.
I had my rare pre-ictal. The rare pre-ictal.
The Alice in Wonderland?
No, I had euphoria.
Oh, you had the euphoria.
Googling
Okay.
more than I know I did.
Unrelated euphoria. So
But
being
not
extremely happy, but out of
always
context.
related, yeah.
Right. Okay, and you're right. It's
But I don't
unusual.
get that much.
No.
Normally I get dread.
Absolutely. Normally it's the dread side of things.
And Alice in Wonderland.
Yeah.
I didn't
Hey, look, I've ever
get
had the
that.
euphoria any day too. Hey, go figure. But no dread. That's okay. You had no ability to communicate. Hey, Google, stop in regards to the cheese.
I had the cheese.
You had the cheese in your hand, and
Did
I
I
took
drop
that.
it?
No, you didn't drop it. I took it out of your hand. You had no motor control to be able to do any action, and you had, it was a focal seizure at that stage, because you had no ability to communicate, and certain parts of your brain was shutting off before you went into the tonic clonic seizures. You know, you couldn't talk. It's okay. So the cheese is safe over here. What I do need to give you, because of the tics and because of the seizures, and now that you're able to talk to me, I need to give you clonazepam right now to help.
No.
We're not doing this. I need to give you.
What am I tasting? What have you already given me?
I've given you a midazolam. That's going to help you with the seizures. It's not going to help you overall with the ticking.
Isn't that
And
enough?
no, it's not, Bubba. Okay, I need to bring your levels up, because I don't need a whole afternoon of seizures with you. Okay, we're not in a situation where we need to get an ambulance and take you off to hospital
No,
today.
I'm not going.
Okay, so then let's do what we're going to do.
White tablet.
Clonazepam, white tablet, correct. So I'm going to bring you up so that you can.
I had it all planned.
I had it all ready to go. Yes, I did.
Only today.
Okay,
Because of
only
that.
today because of that. Yep, we're doing it PRM. So we're trying to avoid regular scheduling of certain medications, and we're attacking it from a PRN perspective. So patient request, Nicole, where basically if she's having symptoms either beforehand, we've got the opportunity to jump in, we'll take it straight away, or immediately during or post. Now during it's not easy, because she loses the ability to swallow, dysphagia comes in, and she can obviously then also get it down the wrong hole, and asphyxiation, never an easy thing. So I've got to wait for her to come around to a more cognizant state so that she can communicate and also control the swallowing. You want lunch right now? Well,
salad's good.
the salad is good. Well, at the moment your brain's not offline yet. You can see here with the blepharospasms and the oromandibular, the twitching around your lips that you're doing.
And I have too much saliva.
Yeah, you have. So you've got the cloth right there, so you can do that. Do you need another sip of drink?
No.
No? Okay.
I got taste on my tongue.
Oxygen stats are good at 97. Heart rate is much better at 70. I'm just going to take temperature. I'm so sorry.
Ow!
Dramatic.
It's swollen in there.
Right. I'm sorry. Right. 37.5.
It's gone down to 0.2.
0.2, but you're still febrile, okay, and you're very flushed in the face. So you can see in the face just how red Dyan can get with the malar facial rash. It's a butterfly rash, also indicative quite commonly of autoimmune. And for Dyan, having previously been diagnosed several times with SLE lupus, it's an autoimmune condition. She has autoimmune issues tied into her 22q. That's what we already know and understand. Right, ma'am, I don't need oxygen, so that's a great thing. You were able to get through that without having to have oxygen.
It's a sensory nightmare.
It is a sensory nightmare, but aren't we glad that we've actually got it just in case? Because there's many occasions where you cannot control your ability to breathe, and the dystonia affects things like your diaphragm or intercostal muscles and your ability to breathe in your esophagus. Yeah, that's a big problem.
I pulled my calf muscle here.
Okay, well that's not very good. So let's actually have a look at that. Can you wriggle both your toes for me?
Yeah.
Lovely. So we don't have any Todd's paresis this time. The last time that she had a tonic-clonic seizure just recently, she ended up having Todd's paresis. That's the paralysis of the lower limbs for Dyan bilaterally. That lasted about 4 hours before she was able to regain full sensation and move. She couldn't walk. I had to actually literally carry her backwards and forwards to the toilet. So this time, she hasn't got it. Now, the Todd's paresis occurs only in about 15% of Dyan's tonic-clonic seizures. So it's not all the time. But we did predict that this was going to happen today, and we had a conversational video just before this. All right, I'm going to have to look at that.
Oh, I feel like I did the gym or something.
Yes, well, you haven't been to the gym, Missy. I'm sorry. Which one? Left side. Okay, Dyan is dyslexic. She has difficulty with actually explaining which side.
It hurt.
Okay.
I've strained it or something. On this side.
More towards the solus and the left head, medial head of the gastrocnemius.
What did I do?
Okay, so the focal dystonia that you had in your foot, focal dystonia causes very intense contractions of the muscles, causing things to posture into very contorted abnormal positions. Sometimes it will cause them to fibrillate, which is a shaking action. But that tensile position, and particularly whilst having tonic-clonic seizures at the same time, can cause muscle avulsions, where the muscle head, the tendon, attaching to the bone can actually be strained, or the actual muscles, which is a protective mechanism, the muscle reflex action, can actually tear. So we're just going to put a soft bandage on just for the moment. That's what I'm going to do.
Pain. It's not a good pain.
No, it's not a good pain, is it?
Ow!
I know it's tight, but that's better.
I wear that on my arm.
Well, it's multi-purpose, honey. It can be used on your arm, and it can also be used on your leg. It can be used on your nose if you wanted it to be.
It's got a tail.
Okay, are you being worried about the OCD side of things of the threads?
Cut my tails.
Really?
Multiple.
Okay, OCD gets a little bit out of hand sometimes with young miss. Now, Dyan is 51 years of age. Like I said, with her autism, it does make her appear a little bit younger than her actual chronological age.
Don't cut me.
I don't want to cut you at all, honey. Tails have gone. Aren't you lucky?
Just
Oxygen stats of 97, heart rate is 64. Much better. Oh, look, there's threads everywhere you want to find. There's a thread, there's a thread, there's a couple more threads. Okay. The Wizard of Oz. Right, your threads are sorted out.
I'm threaded.
You're threaded. Better than being shredded, is that correct?
I don't know.
So that second timer that went off, can't see me.
I don't know anything right now.
That's okay. Cognitively, you're not going to be quite all there, so that part we accept and understand. The second time that went off was the second time that I applied after giving the midazolam. I gave it a 10-minute countdown, and normally what happens is within 7 to 8 minutes, recovery from the tonic-clonic seizures will occur. Dyan will give us first indications that she's cleared of the tonic-clonic seizures by normally very deep, saturated yawns. I've clearly seen one so far, but also with a post-tremor sort of reaction, she might see things such as dystonia or the Tourette's, sudden rapid movements still keep on occurring, and we might see her cognitively out of action for a while. Big sigh ties into the yawning. Number 2. It's 1:48 p.m. It's currently 20 degrees externally outside. It's 23.4 degrees inside the room. We know Dyan's temperature, core body temperature, is still at a fever. Pain in the head, post-seizure. The post-ictal pain, left temporalis going up into the side of the cranium. Right, left-sided. Yeah, okay. Is it only left-sided? Is it pulsating? Is it sharp? Is it intense? Is it dull?
Feels bruised.
Feels bruised. Okay. That will subside very shortly. Dyan quite typically will have intense head pains, normally bilaterally. Sometimes it'll be temporalis, forehead. Sometimes it's going to be the side of the head. Occasionally it'll be occipitalis right at the very back, but quite commonly more in the centralized regions of the head after the seizures. They last 3 to 5 minutes. More on your left-hand side. You're very left-orientated, aren't you?
I've hurt my sore wrist.
I'm not surprised. The distortion that you had in your focal dystonia. So with the dystonia, the muscle contraction, it's normally a movement disorder originating from the basal ganglia in patients. Generally, Dyan has actually got an issue with the basal ganglia. She's got bilateral calcification plus a movement disorder, which is known as Farr's disease. It is seen in patients with 22q quite commonly as well. It's that extra overcalcification that occurs, hypocalcemia, and Dyan has got multiple spots of calcium build-up in her body, which indicates that third of the serious yawns, it's 150. The tonic-clonics are over. The Tourette's might still be there, but that's okay. The worst part of it's done. You're running a fever, I can give you another Panadol Osteo. Would you like one for pain? No? Okay, a little bit later on I'll remind you and I'll ask you the same thing again. At the moment, the current one that you had earlier on today should be sufficient, but you are able to take more. Does that make sense? You probably look, and you are looking a little bit groggy, so your brain might be a little bit tired and offline.
And hungry.
And hungry.
I need a... Yeah.
I'll give you some fruit juice soon, which will give you an initial boost, and then we'll try and do the eating part. We'll try liquids rather than trying to get you sitting up and doing food.
So hungry.
I get it. Hand is sore, calf is sore, inside your mouth because you had wrist is sore because you had a lot of oromandibular. Could I just have a quick look inside the mouth just to make sure that you haven't bitten your tongue or cheek or anything along those sort of lines, please? You're doing a lot of clenching.
So
Okay, that's all right. Just relax your tongue back in for me. And again. Okay, looks good. I have to look at a couple of different components. One is actually to see whether there's been any biting that's occurred, so there's no bleeding inside the mouth, leading to ulcerations. Do we need to do anything with that? The other thing is teeth. Because of the grinding action, the bruxism that can occur with the oromandibular, it can dislodge the teeth. It can crack the enamel. It can cause, obviously, teeth problems. Teeth are already fragile and more vulnerable with patients with 22q, so we have to keep an eye on that. The neck was very sore and stiff. That's the fourth lot of the deep yawns, so I'm very happy to say that the tonic-clonics are over. Oxygen stats are at 93. Heart rate's at 59. So with the drop in heart rate, there's also been a drop in oxygen. You're 93% saturations at the moment.
Stop it.
And you stop it. Just relax your breathing. It's at 95%. Good. Sometimes Dyan's oxygen can drop quite considerably after seizures, and obviously once it goes below that 90, go down to the 70% and stay there for a while. We just need to be mindful. We have the oxygen concentrator to be able to apply supplementary oxygen if we need that during that. Lots of yawns. You're very tired from all of that, aren't you? It's a physical workout. It's like going to the gym, but without going to the gym.
Yeah.
Yeah. Did you hurt your neck at all because you were very tense around the muscles of the trapezius and the sternocleidomastoids?
I've been sore already.
You're sore already.
Oh, I won't.
Slow it down. Choose your words. Speak
Tomorrow I'll feel
it. Tomorrow, post-seizure. That's okay. Because you rolled to your left and you did a couple of good tonic clonic seizures, your right arm was flapping. Do you have any soreness in your glenohumeral joint?
I'm sore here.
Sore around the latissimus, the wrap of these external obliques. Okay. That's not surprising because you were straining. Because you're reaching in this upper arm reach, it actually engages this muscle here.
Sore here.
Yeah, and I'm not surprised there because again that's what you rolled onto, was in an awkward position, and you had dystonia locking in at the same time whilst doing a seizure, which you'll see back. I'll look some of the videos later on so she can see what happened for her, to educate herself, to also see what's causing what pains, what areas were accentuated. You know, the hips were again engaged, causing a rotation inwards of both legs. Both feet were doing focal dystonia as well.
Stronger. I can feel how strong it was.
Okay.
All I was thinking was like, I can't win. I
No.
take some medicines to help my GI.
Yep.
And it did.
Mm-hmm.
And then now I'm getting stronger again.
I know. So at the moment we're on the pathway
My stomach muscles look like I've done 1,000 sit-ups.
without having the benefit of it.
And my bum.
Right.
It's like I've been walking upstairs.
You're doing the stair climber as well.
Yeah.
Wow. You have a nice perky butt then after all of that, eh?
Ow.
Poor
Stomach
thing.
muscles. I'm going to have a 6-pack.
You have a 6-pack.
Do I have a 6-pack?
You have a 12-pack at the moment. Mine's looking a bit like a keg personally.
Is mine a 6-pack?
It's at least a 6-pack. Yeah, you're doing well.
I think that's a middle-aged 6-pack.
That's doing pretty well if you ask me.
Just draw some lines.
Considering, you know, we can draw some lines in.
Draw some lines.
Make it look good. Like noughts and crosses. So if we do noughts and crosses lines, and I can play
No, I like
tic-tac-toe on you.
6-pack.
6-pack. Right.
You get makeup.
Yeah. You don't need that.
No.
No. You're looking good already.
It's like, it reminds me of my baby's bellies.
Yes, indeed. Do you feel swollen in the belly because of the inflammation from the antibiotics and the UTI? It does make you swell up. You've had a lot more fluid retention in the last 2 to 3 days of notice, particularly full body lasting with pressure. So when we're actually pressing in, the edema is holding in that position and not releasing for long periods of time. So pitted edema. You were very shaky beforehand, but the shaking's gone now. Yes, it has, but you were very much shaking just before going into it. I wonder if that was a dystonic reaction prior to what was being seen. Because the dystonia causes muscle tremors. So Dyan was shaking quite a lot just before the action.
After.
It was 5 minutes after the tremors were noted in your hand that you went into that.
Yeah, but how long before?
Trying to find words, trying to actually be coherent in the
The other
communication is very
video
difficult.
we just did.
Yep.
I've lost track of time.
So it's been about 20 minutes since that last video.
So 20 minutes after the video, something went wrong.
The irony of it, the last video was indications of, hey, I'm seeing quite a
But
few
you know
signs
what
that
I
might
also
lead to a
felt?
seizure. Are you feeling seizure-y? And she said at the time,
I was going to say it again because I
Yeah.
walked around
Right.
to check the iPad.
Yeah.
There's iPad stations over there.
Yeah.
And then I came back around
Right.
and I kind of paused because I didn't know what I was doing and I went a bit weird. And that's when I, in my head, said, oh, I'm going to have a seizure maybe.
Okay, and in your head,
And I
did you
didn't
think
say
about outwardly telling Matt that I might
laid
have that
down
feeling?
And the cheese came and I just folded it
Yep. And
in
then
the
you,
way I like it.
yep, in quarters,
And
very
then
particular.
poured one bit at a time to make it 4 equal pieces.
4 equal pieces, very OCD of you, yep.
Add one piece.
Right.
Delicious.
Okay, so you had one of the 4, and then
And
you
then
were
I
locked.
Froze.
You literally were in that position,
And then I was like trying to give it back to you.
and you couldn't move, you
I
couldn't
couldn't
communicate,
speak.
there's no articulation. You were locked in at that point in time, starting the seizures, unfortunately. Okay. So, in that step, only a couple of minutes before that, when you were over there and about to walk around here, did you think to tell Matt, hey, I had this feeling and I feel like I might be going into a
I
seizure?
gave you a look, but I didn't say. Because
I meant to just read the look, right?
my mind was thinking it,
Right.
but I didn't know how to explain it because my legs felt heavy. I felt like my depth perception was funny.
Okay, so these are all pre-ictal indicators that you're about to go into a seizure.
I knew that's...
Dyan with the interoception with autism finds it difficult to actually, first of all, identify what's going on inside of her, but then to take that cognitively to the next level of saying, hey, I need to take an action myself, or let alone tell Matt, so that Matt can get prepared at least for it all. Okay.
I didn't even think that we could possibly...
I'd like you to look back at the video. I'm going to post the other video just before this video as well, which starts to discuss why I'm thinking, is Dyan about to have a seizure coming up very shortly? I'm seeing some pre-ictal indicators.
Because what? If I did pre-ictal, based on pre-ictal signs, did something, then the seizure would have happened anyway, because you're already there, right? It's already starting.
Right.
And it's pre-ictal, right?
Yep.
It would have been longer and prolonged and just gentler, but yeah, more frustrating.
Yeah.
But I'm concerned on how powerful those were.
So you're feeling the strength and the intensity.
Change.
You go off the medications, your seizures will come back.
So I have
stronger, longer, and more often.
I have been healthier in other ways.
I get it.
Making this decision. So
this is the weighing up phase.
It sucks.
Do I help my GI tract to be able to poop?
I've got to do both.
Or do I have seizures?
Both. I have to manage both.
We have to find middle ground. And that's part of our challenge when you have a multi-systemic, complex situation where there are 24 different specialists that are meant to be involved in Dyan's care that don't coordinate, who are all compartmentalized. They don't even talk to each other. What are you feeling? Dyan has to cut off all the labels of her clothes because of being autistic and the sensory thing. Are you feeling? Yes, there is something sharp there.
That's the tag.
That's from the tag that you cut off.
It doesn't even work when you cut it.
You still have the sensation.
It was scratching.
They shouldn't put tags into clothing, should they? Even though it's a Disney princess top.
Yeah.
No, right? Go for you go. Guys, thank you very much for hanging around and being with us.
Sure.
You could. Thank you for being with us.
Guys.
Dyan will be okay, but it'll be watched closely now for a couple of hours. And we'll have some of your boost juice.
And the garden salad.
And then your garden salad.
With balsamic vinegar and cheese.
Exactly. And she won't be getting out of bed. She'll be relaxing. She'll be just taking things slowly.
I probably have to have a bath though for break a fever. No? Not
at this stage. I think your energy levels are so depleted. I think you're at very high risk of more seizures this evening if we don't keep on top of things. It's only 2 o'clock in the afternoon. Normally the seizures are seen late afternoon, 6 o'clock onwards for Dom.
You gave me the medicine. You're saying?
That's only the clonazepam in May, and it may not work.
It will.
It will. Positive things. Guys, if you have comments, questions, ideas, and suggestions, leave them below. If you're new to the channel, don't forget to subscribe and hit that notification bell.
If you get seizures, I respect.
Respect, indeed.
It's not fun.
No, they're not fun.
For you, for me.
Well, certainly not for you. Absolutely. Just a disclaimer, as usual, we are not medical professionals. Anything that we say here is about Dyan's experience as a person with 22q11.2 deletion syndrome, us in our household as a carer, partner, and guardian having to look after Dyan in the situation when the WA health system is actually failing us and not giving us the help that actually is necessary for Dyan's care. We are still waiting to hear back from the NDIS Complex Support Needs Planner who was meant to call on Monday. Today is Wednesday, haven't even had an email. I am guessing that she is off sick from work, and when she'll come back she'll have to touch base. But these are the delays. These are the things starting from January where an urgent change of circumstances was put into place, and we have now stepped into what month? September. We're already past the first into spring. That's okay. That's what an urgent change of circumstances does. If you need help in your conditions, please go and see your primary care physician, your GP, or a specialist. That's what they're there for, to diagnose and arrange medical treatment and plans for you. We are here to educate and advocate for Dyan's multiple different rare conditions and how we live dealing with them all, and particularly autism, because that gets in the middle of everything. And it affects understanding, self-awareness, communication. No, you can't. You're born with it, baby.
It's part of you.
It is. It definitely is. All right, guys.
And it's only a disability to other people who
That's
don't
right.
have
We don't make accommodations.
Society. We are just different
It's a superpower.
thinkers, and just don't let anyone put you down because you're different.
Absolutely. Thanks guys for watching. See you soon. Bye for now.